Yes, you're welcome to my channel. It's your boy Jacob right here in Maryland, USA. Now today we are going to talk about the medical tests you have to take before your immigrant visa embassy interview. Remember, when you get your appointment for your immigrant visa, for your embassy interview, before you go for that interview, you have to take a medical test. Yeah, medical tests are very important during your immigration because they need to assess you to see that you are fit or you don't have any infections. You don't need to transfer any infections from your country to the country where you want to go. So today we are going to look at those medical tests and assessments which you have to take before you go for your immigrant visa interview. So when you get your appointment for your immigrant visa interview, the first thing is you have to book for your medical test at IOM. For the US embassy interview, most of those medical tests and assessments are done at IOM. Now, what are some of the requirements you have to go with at your medical examination? First of all, you need to go with your embassy appointment, your booking date. You need to go with your passport, and also you need to go with money. Yes, they will tell you the amount of money you need to pay them at the examination area. It will depend on your family size. If you have a big family, the amount will be quite big. If you have a small family or if you are alone as a person, it won't be a lot of money. But basically, before you go there, they'll give you an average amount of money you have to go with at the examination area so that you don't get surprised. So they will estimate for you the amount of money depending on your family size and the number of people you have booked to go for the examination. Now, what happens at IOM if you go for your medical examination? First of all, they will triage you and pay. Then usually the first test before you do anything is the chest x-ray. If you are adults, they will take a chest x-ray. If you are alone, they will take you alone. If you have a spouse, they will take a chest x-ray for you and your spouse. So basically, why do they take this chest x-ray? They want to rule out tuberculosis or TB. So basically, you can take a chest x-ray. They will take you and your spouse, and basically if that chest x-ray has any scarring or any abnormal findings, next thing they will do is they will take a what they call a sputum analysis. The doctor, the immigration doctor will tell you to do this if a chest x-ray is not clear. But if your chest x-ray is clear and has no abnormality, you'll go ahead with your immigration process. But in these times of COVID, actually most people had a lot of bad x-rays. They had scarrings, they had abnormalities, and most of them were told to do sputum analysis. So if your chest x-ray has an abnormality which is not clear, they will tell you to do a sputum analysis before you go ahead with your immigration process. My advice, which I give most people, is before you come for your medical exam, first do a pre-chest x-ray at home. First do an examination at home to see if it's clear. If it's not clear and you have any disease like tuberculosis, first treat before you come for your medical exam to avoid an interruption in the process. Because if the sputums are positive, usually they allow you to take like 3 sputum analysis on consecutive days, something like that, before you are given a go ahead. If your chest x-ray is bad. But if your chest x-ray is clear, they will tell you to go ahead. But if your chest x-ray has a problem, you will take sputum analysis to confirm tuberculosis. And if you are found to have tuberculosis, you need to go for treatment for 10 months before they can clear you to go for your immigrant visa interview. So that's how serious it is. Having a clear chest x-ray is very important during your assessment. For children, they don't take chest x-rays. Children, they do what they call an IGRA test, a blood test for TB. They will take off blood tests from your kids. If you have kids, they don't do chest x-ray. They take off blood tests from your kids. It's called an IGRA test, and still you have to pay for it. So after 5 days, they'll confirm if your child has no TB. If they find some positiveness in your IGRA test, the children need to go for chest x-ray as well. So that is how important it is. So those x-rays need to confirm your TB. If you have TB, that's a big problem for you, because you need to go for treatment for at least 10 months before they can give you a go ahead for your embassy interview. So what else apart from the chest x-rays and the blood test for TB? Another thing they look for, if you are an adult, they take off your blood to rule out diseases like syphilis and all those other conditions. Initially, they used to take off also blood for HIV, but nowadays they don't. They have taken it off. So basically, they look out for those other infections like syphilis. So they take off blood from you and also from your spouse if you have one. So that is another thing. Another thing, what do they do at the medical exam? They do a full physical examination for all of you and your dependents. So basically, you go to the immigration doctor, he examines you from head to toe. They ask you your history of chronic illness like diabetes, asthma, hypertension. If you have past surgeries, they also ask you questions. So they examine you each and everything to see that you are fit to immigrate. If they find out any unfitness, they will tell you, but usually they examine you from top to bottom. They tell you to take off your clothes, you stay in your underwear. They examine you from top to bottom, just like how you go for any medical examination when you are going for most of these doctors on the outpatient. That's the same thing. The immigration doctor will examine you from head to toe for you, your spouse, and all your children to look out for abnormalities, and they record that information and they send it to your immigration officers during the day of your interview. So apart from chest x-rays, blood tests, physical examination, what else is done at IOM during your assessment? Another thing which is very important is immunization. They check your immunization history at IOM when you go for your examination. So it's very important you go with your immunization history or your immunization cards. So basically, what do they check for? During nowadays in the COVID pandemic, you need to have immunized yourself with COVID vaccine. Yes, if you are not immunized, they will immunize you. Yes, at IOM they immunize, but at a cost. So you need to have taken at least 2 of those vaccines, the ones which are recommended by the World Health Organization. Any of them, whether Moderna, AstraZeneca, whatever it is, they might to be 2 of them. If you are not immunized, they will immunize you at IOM. What other tests, what immunization do they expect you as an adult? MMR, measles, mumps, rubella, 2 doses. What else? Varicella vaccination for chicken pox is very important. Hepatitis B, you need to have records of all those ones. Flu vaccine, you need to have been immunized of flu vaccine. Polio vaccine, ADSL, you need to have been immunized of those vaccines before you go at IOM. If you are not immunized, they'll immunize you, and that comes at a cost. They'll immunize you and your kids if you are not immunized. So other people do what they call titers. Yes, titers are very important. So what you do, you go to a place, a designated laboratory in your place, they do those titers. Titers basically show the antibodies of diseases. You can do titers of MMR, you can do titers of varicella and hepatitis, and they show antibodies. If you have those antibodies of those illnesses, you don't need immunization. So when you are going at IOM, you need to have those records of those titers, and you show them that you have positive antibodies for those illnesses, and they will not require you to get immunized. So you need to have evidence. So even for your children, they need to show evidence of immunization. Bring those government immunization charts. according to your country. So bring them and also get them immunized for RSL and other vaccines. If there's any other vaccine which is not there, they'll give it to you at IOM with a cost. So basically that's what you have to go through when you go for your medical interview. When you go for your medical examination at IOM. Chest x-ray, blood draws, immunization history, full physical examination. That is what happens at IOM. If you're a single person, you'll be out of IOM within 3 hours. But if you have a big family like 3-4 kids, you always take longer because they need to look and examine each and every person in your family, check the immunization history, check the x-rays, do everything to make sure that you are fit. Most IOMs, they send those results if you are fit to your embassy at the day of interview. So they interview you while seeing those results. But if they find anything like a TB, what they do is you go on treatment for 10 months before you go for your embassy interview. So IOM has to give you a go ahead before you go for your embassy interview. We shall I'm going to make another video about the costs. I need to make another video about the costs you need to go with, the amount of money you need to go is, the costs of the vaccines, the chest x-rays, so that you can know the amount of money you need to go with at IOM, because all those tests are paid for. Yes, they are not for free. If you are single, less are the costs. If you've taken the titers, your cost will be less. If you have a big family, your cost will be more. So it depends on your family size and the number of tests and the immunizations you've taken. So this is a short tutorial to tell you basically what happens at IOM when you go for your medical interview. Thank you very much for logging in and listening to my tutorial. I'm going to make another tutorial on the total cost, the estimated amount of money you need to go with for your medical examination at IOM.